Hello, I've always thought abfraction to be very interesting because there was a time that we thought this was caused by toothbrush abrasion. And when I had my teaching center in Dallas for 20 years at Baylor College of Dentistry, I taught 10 two-day courses a year for 20 years. And they were hands-on courses from everything from treatment of TMJ and myofascial pain to occlusion to veneer preparations and seating of veneers, crown and bridge, everything. There would be dentists that would want to debate or argue that this was caused by toothbrush abrasion. And that's what we used to think. Now we know that's not what caused it. A tooth is like a paper clip. And if you hold this part firmly and you flex this part, you can break that paper clip. So the root is held by the bone. So you can see the patient has worn these teeth. Abfraction is not caused by big demonstrative clenching. Bruxing and movement of the teeth together is caused by clenching. That right there. And it's like flexing that paper clip. And this is the flex point. See, the root's held by bone, and so the patient flexes this part and they abfract that part, or they blow the enamel off the tooth. So you're this naive dentist and you come in and you say, I'll fix that, I'll put in some bonded composite, but you don't give them a night guard. Guess what's going to happen to your lovely, beautiful bonded composite? They're going to flex that off. See all the wear? This is from just clenching and grinding. Now this is when we know that this is from flexure, because the same thing that happens to teeth can happen to veneers or crowns. Because when I first saw this, when we were first talking about abfraction being the cause, you think, what possibly could flex that? These were made of porcelain, that porcelain off the tooth right there. What's the stress? Maybe if somebody hit them in the mouth, which didn't happen. This is flexure. That's the flex point of the tooth, and that comes off the tooth. See, here's another one right here. This is porcelain on the teeth, and this can happen to zirconium, lithium disilicate, Emax, porcelain, any tooth color. This right here, this is flexure. They're clenching those teeth. Guess why every patient most of my patients and every patient I restore, especially if they have veneers or anterior restorative work, has a night guard. I don't ask them, do you want a night guard? I give them a night guard. Now, if they decide not to wear the night guard, I say, thank you. Thank you very much. You're like an annuity plan for my practice, because you will do exactly what you did to your teeth to my restorations. Remember, restorations don't keep people from grinding their teeth. And just because you've got porcelain or lithium disilicate on the teeth, or even zirconium, that doesn't mean they're going to hold up. They can break anything tooth colored, and even if it's gold, they can grind through the gold. So a night guard, a properly made night guard, watch my video on how to make a night guard, is a part of the case. See, here's another one. See, and this one is fractured right here. It's about to come off. I call it good-hearted woman syndrome. At night, they're working out not just their issues, but the issues of all the people they care about around them, and maybe all the people in the world. And they're clenching those teeth. Good-hearted women make the world go round, but it's hard on teeth. They're clenching and grinding. So almost everybody ought to have a night guard. If they don't have a night guard, then that means they snore, and they have a dental sleep apnea snoring appliance like I have, which work fabulously. I'm not going to tell you something that's not the truth. These dental sleep apnea snoring appliances made by Somnomed are fantastic. They work. See this? This is clenching on that tooth, and that's the flex point. See, the root's down here. This is the top part. It's just like a paper clip, and that's what fractured. So if you restore this and a patient doesn't have a night guard, or they don't wear their night guard or dental sleep apnea snoring appliance, guess what's going to happen? They're going to break the composite off the tooth. And if you haven't talked about it, written it down, you could get the blame. So don't make the patient's problem your problem. You want to be the nice person and fix the problem. You don't want to be married to this person forever, replacing that composite that keeps popping off. I put on the chart, do not guarantee this composite. Now you may replace the veneer, but you may want to replace this with a composite initially and just let the patient prove they will wear the night guard and aren't going to break it off again, because you don't want to put a veneer on there and have the patient do this same thing to the new veneer. You certainly don't want to do any restoration on that abfracted area and not write down on the chart and possibly have the patient sign it, this will fracture again if you don't wear your night guard. And that means when they're taking a nap, anytime they're sleeping. Now, when they're not sleeping, tell the patient to take a deep breath and hum. And that puts the lips together and the teeth apart. Tell them, don't make that sound if you're with other people, but the only time teeth should ever touch is when you swallow. Go ahead and swallow. Let your teeth touch together. The teeth shouldn't be in contact as you go through the day. Even when you eat your food, the teeth should not be touching. Only when you swallow, and then very lightly. So if the teeth are together during the day, they can do this during the day. Then at night, if they wear their flat, plain, hard acrylic night guard, that's going to keep them from putting pressure here, because you want that night guard, the teeth to slide on the night guard. You don't want it to have teeth indentions in the night guard. You want it to be a flat plane with the only teeth contacting being the anterior teeth, and that takes 90% of the pressure off the muscles of mastication and the posterior teeth. 90% of the muscle fibers shut down if only the anterior teeth are contacting, because the brain says, okay, we're incising, we're not grinding, so we're going to be dainty, and just 10% of the muscle fibers contract. So night guard is mandatory. Look at this guy. When you see recession and abfraction, that is from clenching. It's not from toothbrush abrasion. Think about a fence post on the side of a hill, because you remember the alveolar process goes down over here and down on the inside, so it's like a mound. So these teeth are like a fence post on the side of a hill. If you move that fence post this way, the dirt on the side of a hill is going to go down. The dirt around that fence post is going to go down. So that's what happens when it comes this way. The alveolar process and the gingival tissue goes down, and the flex point is right here. This kind of stuff. It's not a debate. You don't just debate it with the patient. You say, we're not discussing it. I'm telling you what it is. And I don't even want to see all the fracture in here. This person's highly stressed, a trial attorney, and he's just broken all the porcelain off the facial of those teeth. Here's another one. That's from flexure. It's not a debate. That's just what it is. That's abfraction. You can have it on teeth, but I've got a whole series on how this happens with restored teeth. See this right here? You think, how would you do that? How would you fracture that any other way? You can't. It's flexure. This right here. If you look at the underside of these teeth, they're going to be, if they were natural teeth, they'd be worn. See, we've done this up here. All these have got, starting to get recession and little crevices, the gingival line. Here's another one. This is a natural tooth right here. This was a Baylor professor, and he had abfracted his tooth into the nerve of the tooth, so I had to do endodontics before I bonded it and remind him. See, here's a little abfraction right here too, right there, recession, abfraction right here. Just, you know, what is stress? It's really not stress. Is stress a woman with 3 kids? Is it the President of the United States? Is it a guy diffusing bombs in another country? You know, what is stress? It's the response to stress. And it's just that whatever makes people clench their teeth at night. You'll see these are natural teeth. We bonded it. Now if I bond that abfracted area with composite and they don't have a night guard, this is going to fracture. And I tell them, even if you have a night guard, it's going to fracture, and I can't stand behind it. You've got to decide if this bothers you or not, because I'm not standing behind that, because if you nap and you don't wear your night guard and you clench, you can break it loose. Don't forget this. A dentist told me this one time, one of my mentors. He said there's no restoration you can place on a patient that they can't destroy if they try hard enough. So you're the person fixing the problem. Your obligation is to be highly trained, highly educated, and in my opinion, use the best materials there are. We can fix it, but we can't keep it fixed. It's like restoring an Indy 500 car. You can fix it and they're perfect when they start the race, but there's so much pressure on that car driving top speed 500 miles that by the end of the race they're a train wreck. The teeth are the same way. You can't stand behind it. You wish you could. Even gold restorations, people can grind through them. They can't break them, but they can grind through them. So bear that in mind. You don't want the problem the patient has to be your problem. That's abfraction. That's the Dental Minute. These techniques work, and they work every time.